Assalamu alaikum wa rahmatullahi wa barakatuh, brothers and sisters. I would like to thank you for this invitation to participate in this great conference. And I would like to talk today about the COVID-19 pandemic and how it exposed the weaknesses of the healthcare system, of the capitalist healthcare system. A few issues I'm going to talk about. Number one, about deficiency in healthcare resources. Number two, about the social way of life in Western countries. Number three, the intellectual property rights. And number four, vaccination issues. Number five, the scientific research issue. And all of these issues and its impact on the healthcare system. Then I'm going to talk about conclusions of these issues and then solutions to provide for these problems. Number one is about deficiency in healthcare resources, including providers, facilities, hospitals, schools. As we know, the main problem that faced the healthcare problem during the pandemic, especially by the beginning of the pandemic, was the deficiency in healthcare hospitals, deficiency in providers, doctors, nursing, ICU equipments, including ventilator, even deficiency in the mask for protection from the virus. As example, in the United States, there are 98,000 of ICU beds and 160,000 of ventilator to serve 330 millions. So this deficiency actually pre-existed prior to COVID, but what happened during COVID with more patients? It did expose all of these deficiencies and problems and actually pre-existing problems. As we note in these two graphs here, in the right side here, the countries with most critical care bed per 100,000 inhabitants. As example, with number one here among these countries, United States with 34 critical care bed to serve 100,000. Despite in this graph, the United States was like number one with the number of critical care bed. Despite this, as you see in this graph here, this is many hospitals in the US were running critically short of ICU beds during the pandemic. With the red color here represent the ICU occupancy rates of more than 100%. So ICU beds were over-occupied more than the limit and more than the available beds to serve the patients in several states. And when we say ICU beds, we are not just talking about a room actually. It's more a whole team who's providing healthcare to this room, involving providers, doctors, ICU doctor, ICU nurse, equipment, ventilator. So when we say deficiency in ICU room or bed, it's a deficiency of a whole team to provide this type of care to these patients. And this is, with these numbers, it's a pre-existing problem that was exposed during COVID pandemic. Again, the shortage and deficiency was not just in the hospitals or ICU beds, as we see here also in doctors and nurses. As you see here, these are the average, the countries with highest density of doctors to serve 1,000 inhabitants. As example, in the United States here, 2.6 doctor to serve 1,000 inhabitants in the country. Nurses, about 11 nurses. So deficiency, hospitals, in ICU rooms, ICU team, doctors, nurses. So that's why when there was more patients, it's the healthcare was facing very big problem in taking care of these patients. Number two, the social way of life in the Western countries. As we note during the pandemic, there were more cases in the Western countries in terms of sick patients, in terms of patients in the ICU, also death rates, and it was noted that there were more sick patients or more patients in the ICU among elderly. Number two, also patients with chronic diseases, and also in immunocompromised patients. So these represented the main risk factors. And again, so we note more cases, more death rates in the Western countries. And it was noted that there are several factors and variables in the Western culture that created the problem to be more worse. As example, as I mentioned, chronic disease is one of the risk factors to be more sick and to be in the ICU. So we note that there's more prevalence of chronic diseases and its influence in the pandemic in the Western countries. Also, I'm going to talk about the social system and the social life of seniors in the Western countries. Since we said among the risk factors, chronic disease and elderly, then we need to study what's the prevalence of the chronic disease in the United States and what's the social life and the lifestyle of the seniors in the United States. Also, the average life expectancy and the nutrition and its impact on the health. Also, the immunity and the immune system. As example, chronic diseases. Based on the CDC website in the United States, 6 out of 10 adults in the US has a chronic disease, one chronic disease. And 4 out of 10, like 40%, at least they have minimum two diseases or more. Chronic diseases like hypertension, diabetes, cancer, lung disease, stroke, these are chronic diseases. So 60% of adults in the US, they have at least one chronic disease. And 40% at least 2 chronic diseases. As we see here, also the prevalence of chronic disease in the US is going up. Since 1995, 180 million. In 2030, expected to be 171 million. So based on the CDC website, there are several different factors in the United States that contribute to this high prevalence of chronic diseases. Number 1, excessive alcohol drinking. Number 2 is the poor nutrition with low fruits and vegetables. Number 4, the physical inactivity. Number 5, tobacco use. So these are the 4 main factors that affected the prevalence of chronic diseases in the USA. As I said earlier, the more chronic diseases, the more patients get sick with COVID, the higher risk to be in the ICU, the high death rate. And the reason behind of this chronic disease is number 1 is alcohol use and the poor nutrition, the physical inactivity, and tobacco use. Alcohol use, as example, is a major risk factor for different chronic diseases: hypertension, diabetes, stroke, cancer. Besides chronic diseases, accident, domestic violence, suicide, homicide, effect on pregnancy, and this is based on the CDC website. And it caused about 95,000 deaths that is related to excessive alcohol use in the United States every year. So almost 100,000 deaths related to alcohol drinking, to excessive alcohol use in the United States. So we did talk about chronic diseases and how it's affected by different factors. This causes more chronic diseases, more patients who are sick. Number 2, another risk factor during the pandemic was elderly. So elderly, I mean, in the United States, population of 330 million, the people who are more than 65 years old are 55 millions, and more than 85 is 7 million. And the number is increasing. The US population is aging. As you see in this graph here, the blue color represents the population with age from 65 to 84, and the yellow with more than 85 years old. You see here in 2020, there was 47 million from 65 to 84 years old. In 2040, they're going to be expected to be 65 millions. And more than 85 years old in 2020, 7 millions, expected to duplicate in 2040 to be like 15 million. That's why during, and the majority of these people, they live in senior home, nursing home, retirement houses. They are not being served by their families. And this created a risk factor actually. Like when you have 300 seniors, elderly, who live in the same house, when a virus gets there, someone gets the virus, it's going to be very easy to spread to everyone because they are being served by employees who serve them, who get the virus, and the virus keeps spreading. So this creates a major risk factor in the Western countries based on the Western culture. That's why this slide here is a screenshot from the New York Times. And this was in 2020, in December 2020. More than 100,000 of deaths were linked to the nursing homes. About 40% were linked to the nursing homes. So this is how a certain culture will impact this pandemic, like what happened in the senior homes. Number 3 is the intellectual property rights and the COVID vaccine. There are different types for intellectual property, including patents, copyrights, trademarks, and trade secrets. And here we're talking about the patent, which is a government-granted monopoly to build, sell, or use invention. And there is a condition and prevent others from doing so. And this is lasted valid for about 20 years. So prevent others from doing so. This was one of the major problems during the COVID pandemic. So that's why the companies, the vaccination companies, were competing. They were competing for this and preventing others from doing the same. As example, one of the main problems during the pandemic, they said, like the one company had like, let's say, contract with different government to produce millions of vaccines. But this is time consuming because they're gonna produce vaccines to supply several millions. At the same time, based on the intellectual property, they are preventing others from doing so because of the intellectual property. Think about it. If they allow each country to produce exactly what any vaccination company produced, you could get vaccination supply to the whole world within a few weeks, rather than depending in 1 or 2 or 3 or 4 or 10 different companies and preventing different countries and different companies from doing so because of intellectual property. Example of the intellectual property was the TRIPS agreement. It was signed in 1994, in which the World Trade Organization called for a meeting at that time, was signed by 140 countries at that time for intellectual property rights. And this created a problem, as I mentioned, during the pandemic. This was published in the Lancet Journal in December 2020. South Africa and India, they did submit application to the World Trade Organization to waive the right or to suspend the intellectual property rights related to the COVID. But this application was denied. So poor people, poor countries are deprived of the healthcare, but rich individuals and rich countries, they have more access based on the intellectual property rights and the companies in these rich countries. So number 4 is the vaccination issue. Again, we're talking about the same topic here. We noticed different issues during vaccination. Number 1, it was like more a political competition. And it was like more the politicians who are talking about this vaccination issue, and became like more like COVID-19 vaccine racing between politicians. And also there was economic issue, which is competition between pharmaceutical companies, and certain companies even, they did seek protection from the governments for adverse effect. So this influenced the vaccine production and the vaccine distribution. So this is an example. We all recall these situations during the pandemic with the competitions between the politicians during the COVID vaccine race, different talks from different politicians in the United States, Russia, China. It was more like competition rather than being as in collaboration to solve this humanitarian problem. And again, as I mentioned before, like companies, they did seek protection from the government. As example here, you can't sue Pfizer or Moderna if you have severe COVID vaccine side effect. The government likely won't compensate your damage either. Pfizer given protection from legal action by UK government. In a comparison to this, to the hadith, by Allah, Fatima, daughter of Muhammad, والسلام, were to steal, I would have her hand cut off. Rawah al-Bukhari. Again, about the unequal distribution of the vaccines, as you see here, this represents the high-income countries, the percentage of distribution between 40 and 100%, while the upper middle income it goes down below 40, while the lower middle income it goes below than 20, while the low income below than 5%. So you see, the more income, the more access for vaccine, the more distribution. This is similar. This graph was from January to May 2021. Another graph here on March 2021. As you see here, the high and upper middle income countries have secured more than 6 billion out of 8.6 billion of vaccine doses. You see the high income countries here, upper middle income, lower middle, low income. Despite the high income countries represent between 15 and 20% of the whole world, they secured more than the rest of the world. They secured 6 billion out of 8.6 billion, despite they only represent no more than 20% of the population of the world. This is the data of the vaccinated people by January 2022. China about 90%, upper middle income and high income more than 80%. So the lower income, the less vaccination. China, upper middle income, high income, India, lower middle income goes down to 40, South Africa less than 30, lower income countries less than 10, Nigeria less than 5. So the more the income, the more the vaccine. And this is initially created by the more distribution of the vaccine initially to the higher income countries. This similar graph here, as you see here, the high income countries, then the lower middle income, then upper middle income, then the lower income. So the lower income, less than 10% of vaccination, as we see here in the graph. And this is from 2020 to 2022. Again here, rich countries, as I mentioned, will get access to COVID vaccine earlier than others. As you see here by the green, the expectation, this graph was in 2021. So green is access to vaccine by end of January of 2021, like United States. While the red color here in Africa is on 2023, 2 years after United States. And this by itself facilitated the spread of the virus because you isolated in distributing the vaccine to countries based on income, based on rich and poor country. Based on this, you provided more vaccines availability to the rich countries, to higher income countries, which represent less than 20% of the world, while the rest of the world, you delayed the vaccine. So this by itself created an environment for the virus to spread more in the rest of the world. There was a study done in one of the US universities called Northeastern University. If rich countries monopolize COVID-19 vaccine, they did two strategies here. They did study a strategy for the death rate if the vaccine was distributed only to high-income countries first, versus if it was equally distributed. They found out that 33% death averted if the vaccine was only distributed to high-income countries first, versus aversion of death of 61% if it was equally distributed. So this means vaccine distribution to high-income countries duplicate the death rate versus if it was equally distributed. This was at Northeastern University. Also about scientific research, again, this is like in rich countries, intellectual property rights, and this impacted the research, created a competition between the companies rather than collaboration, also created competition between the politicians, while in the other countries or poor countries or the so-called third world countries, most of them, they signed agreement with the World Trade Organization for intellectual property rights, and this restricted the ideas. And beside this, governments, they don't support research, limited resources, limited guidelines, always dependent in the Western countries on guidelines, on medications, on vaccines. Conclusions. So this is, this is a summary for all of these issues. So we note these multiple problems during the COVID-19 pandemic, and it's a pre-existing problem, but got exposed during the pandemic. Number one, political influence on the healthcare problem. Number two, as we note, vaccination rates among different countries and companies. Also the competition between the pharmaceutical companies. Also the intellectual property rights. Also the vaccine production challenge. Also the unequal distribution of the vaccines. And again, this facilitated the spread of the virus. Also certain variables and risk factors in the Western countries based on the culture. As I mentioned, the prevalence of chronic diseases that's being influenced by other risk factors like alcohol drinking, physical inactivity, diet, immunity. Also the lifestyle of the seniors, living in the senior houses and the senior homes. This facilitated the spread of the virus. So this impacted like more cases, more patients who are sick, more elderly who are sick, more patients in the ICU, more death rates. Also, the third world countries depend on the production of the vaccine from other countries. The whole world is waiting for US, China, Russia to get their own vaccine, and they are just waiting for someone else to solve the problem. And this is the main point here, is the one who's providing the solution for the problem, or the current system who's providing the solution for the problem, is looking at the problem as a financial or economic problem. So from this understanding, they provide solutions. Rather than looking at the problem as a humanitarian problem, they look into it as an economic financial problem. So their primary measure of action while providing a solution for the problem is money and financial gain among countries, companies. So having all of these factors, it's all related to the current system that is providing the solution for the problem, which is the capitalism. So it's basically it's not just a COVID-19 problem. It's an ideology problem. The current existing ideology that is providing a solution to this kind of problem based on this ideology. It's an ideological problem in the capitalism. And COVID-19 exposed all of these problems in this ideology and in this system. So in providing a solutions for these problems, then basically we don't need a political influence on a healthcare problem, on a healthcare issue based on political competition rather than collaboration to solve the problem. Also, we need the state to provide resources to support research, to support the studies. Also, collaboration rather than competition. Also, no intellectual property rights that restrict inventions. Also, to support the vaccine production and clinical research. Also, to avoid the unequal distribution based on high income, low income, should be like fair distribution as needed to the countries. Also, no bad habits in the countries like alcohol drinking, and we know alcohol, how it influences the chronic diseases and how chronic diseases influence the rate of infection and the death rate. Also, to be self-dependent and produce your own vaccine rather than depending in Western countries. Also, the main issue here is to look at the problem as a humanitarian problem and to provide all the solutions based on this understanding that it's a human problem, it's a humanitarian problem, rather than to look at the problem as economic or financial problem. And all of these solutions here, you will only find it in Islamic system. So having and implementing the Islamic system will provide solutions for all of these problems and for other problems in the world. Not just healthcare problem, but also other different problems that the whole world is struggling and facing. And these are a few hadiths that the Islamic system provides for humanity. And these are my references. Jazakumullahu khairan. Thank you, brothers and sisters, for the invitation to participate in this great conference.